Hello everyone, I am Dr. Pavan Kumar Boyella, Senior Consultant, Haemato-Oncologist, EMT Physician, CAR T Cell Therapy Specialist, working in Apollo Hospital, Jubilee Hills, Hyderabad. The topic we'll be speaking today is about multiple myeloma, atypical bone cancer. People wonder that whenever you get multiple myeloma, it is nothing but I got a bone cancer. Multiple myeloma is not a bone cancer, it's technically a blood-related cancer because blood actually gets generated in something called bone marrow, which is inside your bone. So whatever affects this bone marrow sometimes will actually affect the bone. Bone cancers are very rare, probably saying less than 5% of the reported cancers. And usually somebody says, I got a bone cancer, it usually is spread from other primary cancers like breast, lung and other solid cancers. But multiple myeloma is a blood cancer where bone can be affected in 80%. So usually patients with multiple myeloma present with, commonly 70% patients present with back pain or bone pain or fracture which was unexpected, and when they evaluate, they get diagnosed with multiple myeloma. Sometimes they only present with their kidney failure, creatinine is high and they probably started on dialysis, and then when they evaluate they would have found it is a multiple myeloma. Sometimes just blood being low, anemia. Patients get evaluated for anemia also can have multiple myeloma. There is no typical cause, but commonly they present with bone lesions. Multiple myeloma is a cancer of the blood cell called plasma cell. Once you diagnose multiple myeloma, which usually involves some blood tests like free light chains and electrophoresis and also bone marrow tests, we confirm multiple myeloma. We have something called risk stratification. We don't have a typical staging, though it was an old way of seeing it, but now we call it as risk stratification, which is again based on genetic tests we do on the bone marrow. Based on that, we have three risks: low, medium and high. Treatment of multiple myeloma is basically drugs, that is chemotherapy, technically low dose, not very high dose like we see in other cancers. It usually involves somewhere of 4 months. Once we give this treatment, we have something called immunotherapy also, which can be given during the induction chemotherapy for a better response. And once a good response is there, based on age and how fit is the patient, some patients will undergo bone marrow transplant, some we avoid bone marrow transplant because of age and other risk factors, and they continue on medications. That's called maintenance. I want to make a statement here. Multiple myeloma is a disease which can be treated but cannot be cured. So cured in the sense we treat once and we never come back. So multiple myeloma with high possibility of relapses. 90-95% people relapse, but it takes longer time. And once on maintenance, we just continue. Patients, if they relapse also, we have n number of treatments like again immunotherapy, CAR T cell therapy, where treatment response in almost 80% people tend to do well for a long time. There are 20% people who are very high risk, where number of treatment options actually we use earlier. Thank you.